Nishka. Thanks, Nishka, and hi, everybody. My name is Arpita Appannagari. My pronouns are she and her, and I am the Policy and Partnerships Manager at the National Institute for Reproductive Health. So I'm going to get us started, and then my colleague, Anjali Salvador, is going to close us out. And today we're going to be talking about working together to create a model city for reproductive justice. Next slide, please. So just a little bit about the National Institute for Reproductive Health for those of you who don't know who we are. We work to protect and advance just and equitable access to reproductive health care. So our strategy is proactive at the local and state level. We work through partnerships and by sharing resources with organizations, individuals, movements around the country. As you can see, since 2008, we've worked in 43 states, including 80 localities, to advance our mission, and we've worked side by side with more than 200 organizational partners. So the partnership model is something that we consider a core of our work, and working at the local level is absolutely another core piece of our work. Next slide, please. I wanted to start out by just giving a bit of a level set on the environment that we're in right now, especially since, us being completely mired in the abortion access movement, sometimes we forget to zoom out for everyone else. So I wanted to start kind of by zooming out. So as you can see in this graphic from the Guttmacher Institute, in 2021, more United States level abortion restrictions were enacted in any year since Roe v. Wade. So what that means is restrictions including targeted restrictions of abortion providers, gestational bans, which we've been hearing a lot about this year, so 6-week bans, 15-week bans, reasons-based bans. So for example, appropriating the language of disability advocacy to talk about quote unquote banning abortion if your fetus has been diagnosed with Down syndrome. These are the types of bans that we've been seeing. And again, last year, 108 abortion restrictions were enacted, more than in any year since Roe v. Wade. Next slide, please. Excuse me. So quickly, 2022 has not looked much better and has in fact looked worse. As of April 14th, Guttmacher has updated their numbers to say that 536 restrictions have been introduced in 42 states. Breaking that down a little bit, 33 abortion restrictions have been enacted in 9 states. And that's just, we're just in April. So there's still a lot of legislative session to go, including some states that are year round. I do want to say, included in these are the ones that you're possibly hearing the most about, the week bans that kind of mimic the case that is at the Supreme Court right now. Dobbs versus Jackson Women's Health is a 15-week ban in Mississippi. This year so far, Arizona, Florida, and Kentucky have signed 15-week bans into law. Kentucky's 15-week ban includes so many restrictions that abortion cannot be legally performed in the state of Kentucky right now. So for the first time in my lifetime, I can no longer say abortion is still legal in all 50 states because that's just not true. We've also seen SB 8 copycat bills, such as in Idaho, that's been temporarily blocked by courts. And we've seen also a complete ban on abortion in Oklahoma. There is some good. Again, as of April 14th, 11 states have enacted, or 11 proactive measures have been enacted in 7 different states. California, Colorado, Maryland, and Vermont have gotten a lot of press about the proactive, the proactive work that they're doing to ensure that abortion access will remain legal in their state. So California, for example, passed the Abortion Accessibility Act, which addresses cost as a barrier to accessing care. It eliminates out-of-pocket costs Colorado passed the Reproductive Health Equity Act, codifying the fundamental right to abortion free from governmental interference into their state law. Maryland passed the Abortion Care Access Act, requiring most insurance providers to cover abortion costs, as well as expanding who can perform abortions. And Vermont approved a state constitutional amendment guaranteeing reproductive rights. So Vermont, along with states like Michigan, will have ballot initiatives trying to focus in on what states can proactively do to ensure abortion access. And as we get into Anjali's portion of this presentation later on, you'll hear more about how cities can step up in the same way that states like California, Colorado, Maryland, Vermont have stepped up so far this year. Next slide, please. I also wanted to level set with new information from Periundum. This is as of February of this year. Abortion access is not a controversial issue. I think the way that we hear about it most often is that there are two sides and that they're equally popular two sides, and it's a really tough fight. But the reality is, it's not a controversial issue. 63% of voters in this survey said abortion should be legal in all or most cases. Only 37% said it should be illegal in all or most cases. 64% of voters say that they would not like to see the Supreme Court overturn Roe v. Wade. This is not a controversial issue. I think people are louder on the other side sometimes. That makes it feel like, oh, there are really loud voices on either side. This is a really equally split issue. Data as recent as just a couple months ago shows us that this is not the case. Next slide, please. Voters do know that abortion access is at risk. So another thing that we often hear about abortion access, especially during an election year like this year, is that abortion access is not a winning issue. Again, the numbers tell us a completely different story. 70% of voters have the impression that the right to abortion in the United States is at risk, and 71% don't even know the laws in place in their states on abortion. So if you take even just those two numbers, educate voters that this is what's happening in your state and this is what needs to be done about it can make a huge difference, especially at the city and local level where things can be a little more nimble and a little more responsive to what's going on. So 56% of voters have a sense that abortion access is becoming harder in the states. 37% have heard a lot about SB 8. 19% have heard a lot about Dobbs. You know, we're seeing that people know that something's up. People are feeling the vibrations in the air. People are reading the headlines. But when it comes down to like the true education gap, we're seeing that not as many people as we think are hearing about this, and more people than we think care about it as an issue. So there's something to be said here for ensuring that we're getting all the correct information out to people and ensuring that the care that they have about this issue is matching the knowledge that they have about this issue. Next slide, please. So now I'm going to talk to you all a little bit about a tool that we created at the National Institute for Reproductive Health called the Local Reproductive Freedom Index, and how the LRFI can be used in cities to really not only shore up access, but protect and support families and healthy and just communities. Next slide, please. The Local Reproductive Freedom Index evaluates the reproductive health, rights, and justice policies in 50 cities across the United States using a variety of indicators. Cities are the natural focal point of work like this for the National Institute for Reproductive Health because metropolitan centers are critical access points for abortion care. In an environment such as the one I just outlined, it really does come down to city officials. City officials are most in touch with their community's needs. They are most able to move with kind of a responsiveness to the environment at hand, and they can most protect the rights and expand access for their community members. In red states, cities can play a leading role in mitigating the harmful impact of state level bans and other restrictions. In blue states, cities can help implement positive policies that are passed at the state level. And they can also be kind of laboratories for innovation. We can use cities in blue states, especially as we kind of hurdle towards a Supreme Court decision on Dobbs. We can use cities as models for states on how to improve access to care. So in the 2021 local index, we took a look at not only the city's responses to, access and reproductive health care, but also implementing a city's response to the movements of the time, right? So to the COVID-19 pandemic, to the uprisings for racial justice, as well as the attacks on abortion access, and including the attacks on democracy and voting rights. The Local Reproductive Freedom Index also provides a policy agenda that any municipality can use to protect and advance reproductive freedom. So I'm going to get further and further into that policy agenda, I promise. But first, I want to tell you a little bit about how the LRFI was created and how it works. Next slide, please. So in creating the local index, it was a 3-part process: original research, phone and email interviews, and then review by partners and local elected officials. So what was really key for us in creating the Local Reproductive Freedom Index was ensuring that we were talking to people in the city, that every piece of the local index was informed and bolstered by information directly from community members, advocates, and elected officials. So not only did we look at city and county websites and databases and publicly available information in our original research, we also went ahead and set up phone and email interviews with our existing partners in those cities, other community-based organizations recommended to us by our partners, departments of health, school districts, city and county officials, municipal elected officials. And then finally, we sent our final scorecards to departments of health, the mayors, city council members, county commission members, to really ensure that all of our information was as correct as possible. So, we end up rating cities on a 0 to 5-star rating. And the way we calculate that star rating is by assigning each indicator a point value. So you get, out of 10 points, you get a certain number of points. And as you can see in this small table here, that translates to a number of stars. Local research can be really, really pretty difficult because some cities do not have county level oversight. Other cities really rely on county level oversight. Health departments can be really key, but also really difficult to get in touch with. A lot of programming that impacts young people. You have to talk to kind of everything that a young person touches, including school boards, including school districts. So the quality of data can vary, the type of data can vary. So we did our very, very best to be as rigorous as possible. We feel really confident in the research that we put together, but it could be that we've missed something. So as you take a look at the local index, hopefully right after this presentation, we would love to hear from you about what you think of the research, and if your city's on there, what you think about what you're seeing. Next slide, please. So these are the city and county scores from the 2021 Local Reproductive Freedom Index. So you'll see kind of really ranging. You'll see San Francisco at a whopping 4.5, but that's kind of, and New York at a 4, but those are kind of outliers. And what I really want to make clear here is we never go to a city, for example, we're never going to go to Billings, Montana and say, how dare you only have 0.5 stars? What are you doing? That is not the goal of these star ratings. The goal of these star ratings is instead to say, you got a half star. How can we get you to 1 star in the next 6 months? How can we get you to 1.5 stars? How can we support you as you start to build up, reproductive freedom, reproductive health rights, and justice in your city? These star scores are not meant to shame, they're meant to encourage. Fort Worth, Texas has 2 stars. That's amazing. Let's see what we can do to get to 2.5 or 3. we're really hoping that folks take a look at these scores and see opportunity. Next slide, please. This is our beautiful model city. I know it's kind of small on the screen, but if you go to our local index itself, you can look at it in all of its glory and really explore further. The model city provides a framework that all cities can strive to meet by using every tool at your disposal to support the freedom and ability of each person to control their reproductive and sexual lives, foster thriving families, and destigmatize abortion and contraception. So what we're not presenting here is a utopia. This is not a utopia. This is not some unreachable pie in the sky, you know, everything held equal place. This is a model city based in the reality of the environment we're in. The reality of the environment we're in includes anti-abortion protesters at clinics. It includes sexually transmitted diseases. It includes, you know, federally funded or locally funded anti-abortion pregnancy centers. That's the reality. What the model city seeks to do is recognize that those problems may not go away, but we can still address them using best practice through research. So what we hope is that folks take a look at the model city and see, where are your growth areas? Where are your gaps? What are places where you think there's a lot of appetite to do something, and where are places where you maybe need to start from, you know, zero and really start to build that appetite? We're hoping that the model city, you know, can really encourage and inspire people as to what is possible in your city as an elected official, as a community member, and as an advocate. Next slide, please. So as promised, I'm going to talk a little bit more about the policy agenda that we've created in the Local Reproductive Freedom Index. What we have, and you can see them in the model city as well, we have 6 buckets that we've kind of gathered different policy recommendations into. So the model city is a really beautiful visualization of where those 7 policies can fit in to the strength and health of a city. And then the policy agenda breaks it down even into specific areas and specific policy recommendations. So our first bucket is protecting abortion access. What this means, or what the model city says protecting abortion access does, is that the city recognizes that abortion is healthcare and takes all necessary steps to ensure that access to that care is safe, affordable, protected, not stigmatized, and not criminalized. Ensuring that clinics are easily accessible, celebrated, and fully integrated into a city's healthcare system. So in that bucket, we have 11 policy recommendations. The next is supporting young people. The city equips young people with the reproductive and sexual health information and services that they need to make the best decisions for themselves. So this is where we have 7 policies, and it includes policies that touch in different places in the city, that touch on schools, that touch on health centers, that touch on extracurricular activities. So really expanding the reach of what it means to support young people. The next is funding and coverage for reproductive health care. City budgets are moral documents. I know that I don't need to say that to anyone that's on this call, but we want to reiterate that by saying the city budget should reflect the city's values by providing funding to fully meet the need for high quality, patient-centered reproductive health care and services, and this is including abortion. We have 9 policy recommendations under this. It's something we feel really strongly about in terms of shoring up access, particularly in a blue state or in a blue city in a red state. Something really strong can come out of this bucket. The next is supporting families. The city supports every resident's right to create, raise, and support their families in a healthy, safe, and secure environment. So when we say this, we say it to draw the connection between abortion access and healthy families. You know, I think a lot of times the anti-abortion rhetoric can get these issues all tangled up and really create the idea that they're opposing values. But what we really want to point out is that having free and available and safe access to abortion is creating healthy, safe, and secure families. It's creating an environment where families are able to choose their futures and families are able to create the futures that they want. The next bucket is building healthy and just communities. So as you can see through these buckets, we're also kind of zooming out, right? We're zooming out from abortion into young people, from young people into families, and now we're zooming out from families into communities. The city is committed to health, economic security, safety, and autonomy for all people, inclusive of their many identities. Its initiatives and programs provide people with the support they need to engage with their community, plan their lives, and achieve their full potential. So this is where these 14 policy recommendations in this bucket is where we really get to draw out the meaning of reproductive justice. And when we say reproductive justice, what we mean. So what we mean is more than just abortion access. It's more than supporting clinics. It's more than funding abortion. It is really ensuring that the full identity of every person is taken care of by the city, that the city supports you in your queer identities, that it supports you in your, citizenship identities, that it supports you kind of throughout the life that you are creating for yourself. And we feel that abortion is a really key and critical part of this, and that all of these things are encompassed by reproductive justice. Lastly, and kind of the most zoomed out bucket, is proclaiming local values. And we have 5 policy recommendations here. The city establishes its social justice values, including its support for reproductive freedom through resolutions and public statements. The city speaks out on local, state, and federal level reproductive health rights and justice issues that impact residents. So again, local values go beyond kind of the microscopic abortion access piece, and it goes really into, what are you fighting for as a city? Who are you showing up for? Who makes up your community, and how are you ensuring that their lives are protected by your values? So we really, the model city and the policy agenda are really meant to be spaces for innovation and imagination. We are really excited about things that push us to try and understand the furthest reaches of what reproductive justice can mean in a city. Next slide, please. So if any of you are like Anjali, for example, I'm sure that you have been thinking like, okay, all of this is really wonderful, but my city's in a red state and I don't know how much of this I'm allowed to do. We've also thought about that. So I want to talk a little bit about preemption. What is it? How do you think about it? And tips for fighting back. This is a whole section in the local reproductive freedom index, but I just want to touch on it here to say that we don't see preemption as the end of a sentence, right? Like if city officials and advocates get together and they have thought through, we really want to try and create this specific policy, but we have a really strong feeling it's going to be preempted at the state level. We never consider that the end of the sentence. The next part of the sentence should be, and how are we going to do it anyways? Or how are we going to try to do it in a way that doesn't immediately tank the policy? So for examples, you can identify supportive coalitions and allied organizations. Sometimes in cities, there will be organizations like progressive political organizations who are dedicated to opposing preemption. So meeting with some of those folks and saying, hey, like, what have you all been thinking about? What are the opportunities here for us to work together? There's also calculating any kind of side or hinge benefits of passage. If the policy that you want to do is preempted, are there other benefits that make it meaningful regardless of that? So most of the time, the answer is yes. Lastly, consider the political landscape. If the state legislature and your governor are conservative, is that ideological makeup set in stone? It's a midterm year. It's going to be a tough midterm year. I'm not going to, sugarcoat it just to make a beautiful a beautiful image for you all. It's going to be a tough midterm election, but if anything, that tells us that none of these ideologies are set in stone. So how can we connect our fight to the voting rights fight? How can we connect our fight to get out the vote? How can we connect our fight to creating the future that we want to see? Next slide, please. So this really quickly is where you can access all things local index. The website is right there for you, localrepro.nirhealth.org. I will drop it in the chat. It includes the self-scoring tool. So what that means is if you don't see your city in the local index as is, you can use our self-scoring tool and give yourself a starred score and see where to go from there. Here's a list of some of the resources that we have available on that website. And then lastly, before I pass it to Anjali, next slide, please. I do want to say city level advocacy will be vital post-Roe. When we say post-Roe, I think some people can see it as defeatist. We just kind of see it as realistic at this point. Cities have a really unique role in the government ecosystem, and that means that there are really distinct advantages. So as I've said before, it's my favorite word to associate with cities. Cities can be nimble. Cities can be really responding to of the moment, in the moment crises or opportunities or gaps. Abortion access is going to be decided at the state and judicial level, but cities can really create a sustainable environment for access. No matter what kind of state you live in, blue, red, purple, whatever it may be, losing Roe is going to be devastating for access. Roe is absolutely the floor of what we can achieve for abortion access, but when the floor falls out from underneath you, there will be loss and it will be big. So in states where abortion is currently inaccessible or will become even less legal, local leaders should prioritize providing information to your communities, shaping policies to help people access care safely, including information about travel. In states where abortion is likely to remain accessible, especially those who lead municipalities that are home to abortion clinics, local leaders need to step up and prioritize policies and practices that will make their communities as welcoming and safe as possible for folks coming from cities where that's just not possible. So thank you all for your time on that. And I'm going to pass it to Anjali, who's going to get a little more specific, a little more nitty gritty with you all. Thank you.
Hi, everyone. Great to be here with you today. Thank you so much for being here. I'm Anjali Salvador. I use she, her pronouns, and I am policy counsel at NIRH. So I'm going to transition over to a discussion of how some of the proactive possibilities that Arpita spoke about have been implemented in practice. But before I go through all of these examples, I do want to emphasize that not all of these ideas are created equal, and that every city obviously is different. Different in terms of the political landscape and also in terms of the support that would be most helpful to your residents and advocates. So any policy idea should be considered in conversation with local advocates and community members too. So next slide, please. So I'm going to start here with financial support because we've been hearing from advocates all over the country that this is the most urgent need right now. Advocates in conservative places are either having to plan how to get people out for care or already having to do that. And advocates in places with greater access are likely going to be dealing with an influx of people. And both of those scenarios require additional funding. So this slide starts with 3 examples of success stories. In 2019, New York City became the first locality in the country to allocate municipal dollars to directly fund abortion. This happened in the aftermath of Georgia's passage of a 6-week ban. The city granted $250,000 to the New York Abortion Access Fund. They renewed their commitment again in 2020 and 2021. Austin, Texas came next. Advocates and local champions secured $150,000 in funding for practical support for abortion in 2019. Practical support means it helps people pay for travel, lodging, and other costs associated with seeking abortions. The Austin City Council also renewed their commitment in 2020 and 2021. And then last year, the Portland City Council, Portland, Oregon, not Maine, allocated $200,000 to the Northwest Abortion Access Fund, which provides direct funding and practical support to people seeking abortion in Oregon, Idaho, Alaska, and Washington. So I also have on the slide a non-exhaustive list of factors to consider when city officials are working with advocates on funding projects. So the first thing to consider here is existing fund networks and their scope of service. Sometimes we hear from local elected officials who are interested in starting new abortion funds, and our advice to them is to always talk to the ones that exist first. Another big thing is administrative burdens, and in particular, reporting and insurance requirements. Abortion funds are often small organizations with very small numbers of staff. Many of them rely solely on volunteers. So of course, we understand that city officials have to be good stewards of municipal dollars. But that being said, logistics that might be easy or customary for larger city contractors are often just straight up prohibitive for small organizations like abortion funds. So when, if you come across one of these contracts, keep in mind that the capacity of these organizations is often very different from other folks you might work with. Another thing to consider is the state legal context. And I think Austin is a particularly good example here. Even in places where municipalities are prevented by state law from funding abortions directly, sometimes they're able to help alleviate the costs that surround abortion, like transportation and childcare. Austin is also a good example of the principle that every year and every budget cycle counts. Arpita talked a little bit about preemption. Even if you think you're going to get preempted, the interval between municipal funding going through and state level preemption is an interval during which more people can get the care that they need. Finally, don't forget to think creatively with advocates about other means of financial support that might help people in your cities. For example, one idea that some advocates we work with are exploring are ordinances requiring that insurance plans for municipal employees or even contractors include coverage for reproductive health care. There's also probably other great ideas out there that we haven't thought of yet. So it's important to, again, listen to advocates, listen to community members, and think creatively about how cities might be empowered to help more people get care. Next slide, please. So another really big theme where local policy really makes a difference is in clinic safety. Arpita mentioned protesters, right? It's very common for people who work at clinics or people receiving care at clinics to receive extreme harassment or even threats, death threats from anti-abortion activists who basically camp out outside clinics, lying in wait for people to come through the doors. So local officials can play a big part in helping to keep providers and their patients safe. But that being said, it's really important to be thoughtful about how exactly to do that for your community's needs. And also, I forgot to say earlier, if you have any questions during this or about Arpita's presentation, please feel free to drop them in the chat, and we'll leave some time for questions at the end. So back to clinic safety, the idea that leaps into a lot of people's minds when thinking about clinic safety is a buffer zone, or essentially a safe zone that allows people to enter a clinic freely. Buffer zones can get legally complicated. In order to stand up to legal scrutiny, any buffer zone has to take into account free speech considerations. Every individual case here is going to depend heavily on the facts and on the particular court. So this is somewhat of an oversimplification, but the basic idea is that the zone has to be crafted in as narrow a way as possible to do what it needs to do. And when I say do what it needs to do, I mean address the particular problem that that particular clinic is facing. I don't just mean general kind of clinic safety. So a good example here is Louisville. A clinic in Louisville had an extensive and well-documented harassment problem with anti-abortion activists functionally blocking people from entering the clinic. So last year, Louisville passed an ordinance creating a buffer zone. It's pretty small. It's 10 feet wide, going from the entrance of the clinic to the sidewalk. So you can see people painting the lines in the photo on this slide. So this is pretty typical. Anti-abortion activists immediately filed a legal challenge. A federal judge has issued a ruling allowing the zone to stand. So this example highlights a few things to think about when considering local action on clinic safety. The first is to talk about people at a clinic about what they actually need. It could be that the problem is mainly centered around a particular entrance or a driveway or the route from a nearby parking garage. Being very specific helps whatever you're doing be more helpful, but it's also a way to help make sure that whatever you're doing is going to stand up to inevitable legal scrutiny. It's also helpful to think about whether a specific ordinance is necessary at all, and to think about enforcement here. So a city might already have an existing harassment ordinance or noise ordinance that could be used to address the problem. So you could potentially, save yourself a city council fight by looking at what's already there and helping it be, more effective in practice. Because sometimes the issue is enforcement and not a lack of legislation. And when I'm talking about enforcement, I want to make sure to mention that city officials should, again, stay in communication with clinics about the role that law enforcement is playing. Some people feel less rather than more safe when there is a heavy police presence. And we've also heard reports of law enforcement officers with anti-abortion views being friendly with protesters, which obviously is not going to help with clinic and patient safety, either actual safety or perceived safety for the patients. Finally, I want to briefly mention the FACE Act. The FACE Act is a federal law. It stands for Federal Access to Clinic Entrances. It makes it a crime for anyone to use force, the threat of force, or physical obstruction to prevent people from obtaining or providing reproductive health services. But it's up to DOJ to prosecute people who break the law, and particularly during the Trump administration, this fell into disuse. There have been indications that the Biden DOJ takes the FACE Act more seriously, but many clinic staff and advocates feel that it doesn't meet their needs, and in practice has turned out to be a little bit toothless. So this is another thing to kind of think about, and the situation obviously may evolve a little bit in the post-Roe environment, and as anti-abortion activists feel more comfortable being outright hostile to those on our side of things. So next slide, please. Another big theme is combating deception from crisis pregnancy centers. So crisis pregnancy centers, or CPCs, are anti-abortion organizations that try to deter people from seeking abortion and sometimes even birth control. Many of them use deceptive and coercive tactics and medical disinformation. They will deliberately set up shop near abortion clinics, choose similar names. The idea is to try to trick people who are trying to find real clinics into going to the wrong place or to finding the wrong place in an online search, and then attempt to shame them into changing their minds. Many of them also use advertising implying that they perform full spectrum reproductive health care when in actuality they don't. So the example on the slide is from a clinic in Minnesota called Robbinsdale Clinic. There's a CPC nearby that deliberately chose a very similar name, and so they have to have signage, or not, I'm sorry, they have to have notifications on their website for people trying to go to the real clinic. Here's where we are, do not go to this other building, because it's deliberately set up to be confusing. In terms of an example of what cities can do, Hartford, Connecticut is an example of a city that passed an ordinance to protect people seeking care from these deceptive practices. It states that pregnancy centers need to disclose explicitly if they do not have a licensed medical provider on staff. Many of them don't, and prohibits them from using false, misleading, or deceptive advertising. This ordinance survived litigation. Hartford is also a good example of how cities can sometimes be more effective and nimble than state level legislatures. Connecticut has also passed state level legislation seeking to combat CPCs, which is a great and good thing, but because it was a slow process, it took multiple years, multiple iterations of the bill, a lot of CPCs changed their practices before the bill passed. So like with buffer zones, free speech is a consideration here. The Supreme Court has struck down some broad CPC legislation in California in 2018. So anti-CPC measures can still be and are incredibly important and helpful, but they need to be, again, very carefully crafted to survive legal scrutiny. Another important thing when thinking about CPCs is for city officials to be wary themselves of these deceptive tactics, particularly when they're giving out municipal dollars. So like I said, a lot of CPCs masquerade as providing health services that they either don't offer at all or offer only minimally. So St. Petersburg in Florida is a city that had affirmed its commitment to accessible reproductive health care. But through a general grant program, they inadvertently ended up providing funding to a CPC and eventually ended up deciding to just revisit that entire grant cycle. So that's an example of a thing to look out for when you're considering who to fund, to keep an eye out for these CPCs. And then again, just to reiterate, protecting people from CPCs is going to get even more important in the coming months and years. There was news coverage recently about the Republican Study Committee sending a memo to House Republicans detailing their post-Dobbs strategy, and a good chunk of it involved directing people and supporting crisis pregnancy centers. So next slide, please. So the next thing I'm going to talk about is anti-abortion ordinances. For a few years now, anti-abortion activists have been pushing ordinances that create so-called sanctuary cities for the unborn. These have passed predominantly in Texas, but they've also been promoted and sometimes passed in Florida, Louisiana, Nebraska, Ohio. This is, a thing that is affecting people nationwide. So there's a few common themes in these ordinances. First is that the vast majority of them have passed in extremely small towns that don't actually have clinics. Anti-abortion activists have been able to move them by going to aligned city council members and then turning out usually local church communities to show up at these meetings. Most of these ordinances say that they will not be enforced by city officials until Roe v. Wade goes down. Combined with the fact that most of these towns don't even have clinics because they're too small, the practical impact is often, honestly minimal. But these ordinances are still super harmful because they confuse people about what their rights are, and they increase stigma against people who seek and provide abortion care. Some of them even go so far as to claim to ban emergency contraception, which obviously from a medical perspective is not at all the same thing as abortion. So I've highlighted two examples here, Lubbock and Edinburgh, which are both in Texas. Lubbock is an example of a situation that's anomalous because it's a mid-sized city. It's not a small town, and it does have a Planned Parenthood facility. Reproductive rights organizations did try to litigate this ordinance because, these ordinances, I should also say, are very clearly unconstitutional. But the court said that there's a standing issue because the ordinance, basically because it hadn't actually been enforced by city officials. And this brings up another point about the importance local work. If this sounds kind of familiar to you, it's because these ordinances were actually the model for the statewide ban that Texas later passed. They were drafted by the same person, a former state solicitor general. So like I said, they state that they will not be enforced by city officials, but they have a private enforcement provision. And so like the Supreme Court did with SB 8, the conservative court panel for the Lubbock ordinance let it stand. Edinburgh's a counterexample of how even in a small town, a relatively conservative town in the Rio Grande Valley, community input can make a huge difference. There was a large outcry against the ordinance there, and the city council declined to move it forward. And I've listed some of these factors to consider on the slide: community viewpoint, legal landscape, ordinance impact. I think all things that are kind of illustrated by the examples that I gave. So next slide, please. Another idea is non-discrimination ordinances. So these ordinances prohibit employers from discriminating against people because of their reproductive health care decisions. An example here is St. Louis, which passed one in 2017. So it defines reproductive health care decision as any decision related to the use or intended use of a particular drug, device, or medical service related to reproductive health, including the use or intended use of contraception or fertility control, or the planned initiation or termination of a pregnancy. So factors to consider here: effort versus payout, litigation, changing legal landscape. Non-discrimination ordinances involve multiple different city agencies usually, as well as individual business owners. It can be with any ordinance, but particularly ones involving lots and lots of stakeholders, it can be a lot of work to get people on board, especially given that these ordinances are, sometimes difficult to enforce. There's also the potential of litigation to think about, like with the buffer zones. So anti-abortion activists did file suit against the St. Louis ordinance. It was allowed to stand, with exceptions made for religious charities who objected. All of that being said, though, I don't want you to leave thinking that these are useless, because they're not. With growing hostility to abortion at the state level, like Arpita talked about, and anti-abortion activists and state legislators feeling increasingly empowered, there's a definite possibility that protections like this will become even more important after the likely fall of Roe v. Wade this summer. So next slide, please. So here we have reproductive justice commissions. The idea behind reproductive justice commissions is to study how cities can improve access to reproductive health care, including but not limited to abortion, and do that kind of in coordination with city officials. So the model here is Atlanta, which created a commission in 2019. NIRH is also working with advocates on creating commissions in Baltimore City and Montgomery County in Maryland. So there's a few things to think about here. The first, as with basically all of these, is the state landscape. Atlanta's commission was created in response to a bad abortion law passing at the state level in Georgia. Particularly with reproductive rights under unprecedented attack right now, these commissions can also be a way for community members and city officials to come together to meet the moment, both in terms of just building community support and then, of course, hopefully in actual policy advocacy. Arpita talked about the concept of reproductive justice versus reproductive rights. So like she said, reproductive justice is a much broader and more intersectional framework than the constitutional abortion rights one. It encompasses personal bodily autonomy, the decision and ability to have children or not to have children, and then also the ability to parent children in safe and sustainable communities. So it can intersect with racial justice, economic justice, environmental justice, and more. So this RJ framework helps to create a broader mandate and greater utility for commissions like this. Abortion is and should be part of the conversations they have, but the RJ framework gives people the ability to integrate conversations about abortion with other types of things. For example, maternal health disparities according to racial and economic gaps. So this is a more holistic way of thinking, and it might create the policy or the possibility of policy movement even in red states. Obviously, Atlanta is in Georgia. So finally, when considering these, it's important to be mindful of who would be on the council. So an ideal model could be one that includes all of city officials, professional advocates, healthcare and community workers, and then, of course, always in consultation with affected community members. Next slide, please. Great. So finally, we have here proactive resolutions. These can look multiple different ways. So I have a few examples here. So Florida passed many local communities in Florida committed to, and then several have passed resolutions affirming that they oppose abortion bans at the state and federal level, and urging all Florida municipalities to join efforts in safeguarding and protecting access to reproductive health care and rights. Atlanta also was in 2019 passed a resolution expressing the city's opposition to the state 6-week abortion ban that passed at that time, although it's not currently in effect. So I have here on the slide that these should be used as a first step, not an end goal. Resolutions are important, symbolic commitments are important, but they are again symbolic. And so to the point that I made at the beginning of this presentation, not all of these options are created equal. But of course, we understand that not every community is going to be able to go straight to funding, for example. When you're thinking about how to draft and promote these resolutions, you want to allow for adaptability in light of location-specific data and advocacy aims. And so with always, it's important to work with advocates and community members so that they can also use these resolutions as an organizing tool. So I wanted to end here. It's easy to get caught in kind of these wonky policy discussions that we've been having or a political rhetoric, but I just think it's always important to remember that we're talking about and trying to help people, and that a lot of people have abortions. Nearly 1 in 4 American women have an abortion by age 45. The majority of those identify as low income. They consider themselves religious. They already have children. Studies show that people who want abortions but are denied them are more likely to live in poverty and suffer from other health issues. And I think at bottom, people know that. Like Arpita said, the majority of people, including in conservative states, don't support abortion bans. And so it is really extremely important, and it's only going to get more important for local level officials to do what they can do to protect people's access to care. And so on the final slide, which is the one after this one, we have a bunch of links. Sorry, do you mind going? Thanks. A bunch of links to different resources. We have the LRFI that Arpita also linked to, a best practices document when it comes to municipal abortion funding created by us, and then All Above All, which is another organization that does great funding work. A document talking about local policy responses to abortion bans, an abortion provider appreciation day toolkit. And I should say a little bit more about Abortion Provider Appreciation Day. It's a day in the spring that that cities basically can use to pass resolutions in support of abortion providers and all of the work that they do. March 10th, thank you. So it's already gone by for this year, but the toolkit kind of helps to gear up, and we're hoping to see more and more people pass these in the future years. Abortion forward language. To my point about everyone loving someone who's had an abortion, it's really important to think about how we talk about abortion. I think there's a tendency right now to use catastrophizing language and to immediately go to the example of people with wanted pregnancies who learn very late that the fetus isn't viable, and those cases are important, but a lot of cases aren't like that. A lot of people are simply people realizing with their doctors, with their families, or for themselves, that abortion is the right decision for them, to the best way for them to have their life. And I think we need to, when we're talking about abortion, to make very sure that we're not talking about it in a way that actually stigmatizes even more the people who choose to have them. So there's a document here about kind of say this, not that, and how to use inclusive language. And if you're interested in those types of resources, we also have many more that we can link you to. And then finally, I included a study on crisis pregnancy centers in 9 different states done by a couple of several great organizations and researchers. It has more data about CPCs and their practices. And also you have our email if you need to reach us or if you have any questions. We often, we're happy to talk to anyone who's interested in learning more about this or about our work. And so that's all I have. It went honestly quicker than I thought it was going to, but that means we have plenty of time for discussion and questions.
Thank you guys so much. I actually do have a question from Carol Gilbert, and she wanted to ask Arpita, can you give an example of when a policy you want is preempted? What are other benefits that will remain?
Sure. So I know Anjali talked about this a little bit when it came to more of the concrete policy recommendations, but what I can say is this: introducing a policy that will be preempted holds feet to the fire in a very specific way. So that there is appetite at the city level to introduce something like, I don't know, a non-discrimination ordinance. And the city council introduces it, and it's on the city council agenda, and there is lively debate about it, potentially testimony about it. It maybe passes, and then it's preempted. The whole process leading up to its passage is airtime for the importance of not only a non-discrimination ordinance, but abortion rights at the city level. It's airtime for the roles that cities can play when it comes to passing proactive abortion rights policy. It's airtime for good information rather than misinformation. It provides opportunity for public education, opportunity to build up the elected official education and elected officials' ability to respond to these moments. And so I think, even if the policy passes and then is immediately preempted, it's a bad feeling, right? I don't want to downplay that. But I think opening up some space for these conversations and for public education opportunities, internal education opportunities, even building appetite for something that was maybe a harder lift, but won't be preempted because you've opened space in this way. So I think there are a variety of benefits. It's less tangible, right? And I think maybe that's the more difficult answer. I don't know, Anjali, if you wanted anything, to add.
Yeah, I think I agree with all of that. I think a couple of things to add are that, so timing is a consideration here, right? So obviously, most states have, or I think all states have a way for the governor to call a special session, but that doesn't always happen, right? So if you think about the timing, there's a decent shot that even a conservative state, you can get some amount of time when your ordinance is in effect before it gets preempted. And that's useful for a few reasons. It's obviously useful because in that time people can be helped, but also you kind of get data during that time, right? Like this helped X amount of people, this was used in Y ways. And so you have that to use basically as a political tool at the state level. But also, in the event that the political makeup of your legislature changes, you've already laid the groundwork for something like that in the future. It can also be helpful, in blue states, obviously you don't have the preemption problem to the same degree, but if you have a local policy, it's also helpful in the sense that it can be a model for a state level policy, in your state, but maybe even the neighboring state who sees it and thinks like, hey, maybe this is something that we can do. And I think, like I said, when I was talking before, I think the Austin funding is a good example. You would not think, obviously, I'm based in Houston, Texas, that you would not think that would have stood, but even state anti-abortion activists, it's not that they like the Austin funding, but they ended up obviously having different priorities. And so that funding program has stayed in place, I think, longer than a lot of us expected to. So I think, you never really know how it's going to go. I think it's always worth trying.
Thank you for that, guys. If you have any questions, please put them in the chat, or you can unmute and go ahead and ask it yourself. While people are typing in their questions, we will be sending out a recording of the presentation as well as the slide decks from both presentations. And that should be sent out sometime later this week.
I'll also say, just as folks are thinking about questions, I dropped the link to the local index into the chat, and obviously Nishka is going to send around the resources. And I also want to say that NIRH is really invested in local work, and especially in supporting local elected officials who want to pursue local work and connecting you to advocates, connecting you to strategy. And so Anjali put our emails at the end of her slide deck, and feel free to reach out to us at any time. If you're taking a look at the local index later on and you see something and you're like, hey, we've been thinking about that in our city, we're always open to hopping onto a call or setting up some time to talk. This is something we care really deeply about, and we're really always so excited to talk to a group of city officials who feel the same.
I'm gonna make the decision that I don't think anyone has any further questions. So I will go ahead and give everyone 30 minutes back in their day. Thank you guys so much for your presentations, and thank you to everyone who's attended. So I hope you guys all have a good day.
Thanks, everyone.
Thank you.
Bye.